Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Now we're going to hear Dr. MOSHIN JAFFER, who is a fantastic physician, but he has one of the very best medical groups in South Florida, and it's called Senior Medical Associates. Says exactly what it does. He loves seniors, and he only brings on physicians who feel that way. And I say that, and it's an important thing because I've talked to physicians who are in the practice, but they really don't like older people, and I wish they'd get out of the practice, but that's not true with Dr. Jaffer. So when you bring on new people, Dr. Jaffer, what are your questions?
It's important. Hi, Joe. Good afternoon to all your listeners.
Yes.
It's important that a doctor must love what they do. Medicine is as much as a science, is as much as an art. So they must enjoy the art of medicine and the science of medicine. And it gets divided up from pediatrics to geriatrics, okay, from one spectrum of life to the other. And some doctors don't like seniors. So the biggest qualifying factor would be that they like geriatric medicine. They like to practice with people older than 65. So that's the first requirement.
Okay.
Number two, they are not into medicine because it's just a career, but because they have passion for it. We have to have doctors with passion for the business of medicine, of the idea of rendering care 24/7. Because even when you go home, you're still on call, and a patient can call you, and you should be willing and happy to take that call, because you know every call you take, you're solving your patient's problem.
I love your philosophy, because there are doctors now who at Friday at 5 o'clock, that's it. If you have a problem over the weekend, go to one of these urgent centers.
It's sad because those outside people they do their best, but they don't know the patient. They don't know all the nuances of the patient. That's why it's very important that every one of us, no matter what age, we have a primary care physician who knows us. He or she should know about our history, our family history, our past medical history, and what's our ongoing medications and what we are doing. And with this electronic medical records, life has become a lot easier because most doctors have the entire patient's record on their phone. So if John Doe calls me up, I know his records by just punching his name on my medical records, and I know it. I know everything about him, even if he's the patient of one of my other doctors.
Yep, that's really the old-fashioned way that people are used to have doctors. I know that they're not going to pay you with chickens and eggs anymore, but at least they can expect someone who like you and like your other doctors. I think, and I just read something, and I was glad that you were going to be on the show today. I read it on the internet, and it was saying that there are many, many physicians who are susceptible to suicide. And I was amazed at that. Why is that?
You see, if I'm a mechanic for a car, if I goof up, I can buy you a new car. But there's no oops in medicine. Damage done to our patients is usually permanent, and it can be even life-threatening. So we are really custodians of our patients' well-being, and for that matter, their lives. And it is stressful because you see a patient, you begin identifying with him or her. Her problems are your problems. And you want to deal with them and emulate whatever you can do as a physician. You get the help of other doctors, you hospitalize them, you subject them to surgery or whatever. But the aim is to get your patient well again so that she may lead her life normally again. And that also quality of life. And this puts tremendous stress on the minds of some physicians. And sometimes it just adds up, especially if they have other compounding factors that they personally are depressed or they have bad interpersonal relationships at home, and sometimes the volume of work is overwhelming. So it's a conundrum, and it's a compilation of all these problems together, push them over the edge.
That's a very, very good explanation. Thank you. I never asked that of anyone because I just read it this morning, and I said, I'm going to ask Dr. Jaffer about it. Well, let me then ask you again. I know we talked about it before you got on the air. You have been practicing medicine for how long?
40 years now.
40 years. And when you went into medicine, it was different. It was the little black bag you carried, I'm sure, and it's not like today. Now, how much adjustment have you had to make?
See, in those days, we visited patients' homes, and we were practicing medicine in the patient's bedside at his or her home. But now medicine has moved on so much that there's so much imaging and testing and blood drawing to be done. And patients now, I find that somehow do even better when they leave their home and come and visit you. So for my senior patients, visiting the doctor is a fun event because our offices are fun. They are not like visiting a gulag. It is open, no door, no windows. Or you can see the nurses working. They know the nurses. They know them by their name. There's familiarity. There's comfort. There is entertainment. There is also refreshment. So for them to get out of the house and go to a doctor's office is an act of mercy and kindness to their own body. Plus, besides that, it gives them an opportunity to meet the doctor in his or her own environment and discuss their problems and seek medical help. So that has become very good. And now we even go one step further that Mrs. Smith can't come or her daughter is not at home. So we can send a car to pick them up and bring them over.
Amazing.
So it has become much efficient and better use of doctor's time than get in the car and go to Mrs. Smith's house and spend half an hour back and forth and then time there. Instead, she is brought by a car home.
I love it.
That is a better use of doctor's time. And also, you've got all the ancillary help. If you need to do an X-ray, if you need to do a blood test, you do it right away.
Dr. Jaffer, I love having you on my radio show, and I interview a lot of physicians, I must tell you, but you are the ultimate. You are the doctor. Have you written a book or something on any of this?
I think I should, because
yes, you should.
I lecture a lot to younger doctors who are in medical school and medical students and residents. And I feel that if we can ingrain in our younger doctors this passion for medicine and the ability to appreciate how rewarding this career is. It's not just a means of earning a living, but it's way beyond that. The satisfaction of life for a doctor who really enjoys his or her work as a passion is very much enduring and also rewarding. So this is my passion to make the doctors realize that they make a difference in people's lives. You see, we, especially as primary care doctors, have the ability to change the destiny of a patient's life. Let's say if somebody has a blockage in their artery, and we think, oh my God, the doctor saved his life because he got a stent or a bypass. The irony is that stent or a bypass will not extend the patient's life even by one day. But if the doctor sat down and says, Mrs. Smith, you're obese, your diabetes is out of control, your blood pressure is out of control, or your cholesterol is wacky, you have a very stressful life, you lead a sedentary lifestyle, you must move more. And if any one of these various factors are corrected, we add multiple years to the patient's life. And it's not just longevity, but it's longevity with good quality of health. And that's the quest in America today. We are now embarking on a plan where we change the paradigm shift from sickness care to wellness care, where we train the patient to take charge of her own health. She's in charge of her destiny. And once you can impress upon them and convince them that they have the power to change their lives. So patient would say, "Doctor, I'm old woman or old man." I said, "Don't say that." I said, "Okay, let's say you are 70 years old today. You think your body is 70 years old? No. Your blood is changed every 3 months. Your skin is entirely changed within a month. Even your bones are remodeled in 2 years. So unlike your Cadillac that you bought 20 years ago, made of steel, is junk today, your body is literally rejuvenating daily. Even at the age of 70, you are renewing yourself. So don't ever consider yourself as an old person. You're only old, I tell my patients, when you're dead. Until then, you've got to think. Until then, you've got to think young, act young, and lo and behold, you stay young.
So you are so motivating. I mean, I am standing up. I was sitting down listening to you. I'm standing up now because I am so motivated by you. You are an amazing person besides being this accomplished doctor. And how do you put the same feelings and the same information into the doctors that you hire? Do they watch
because
you?
Because they work with me.
Okay.
They work with me for a while, so we critique each other and we tell each other what works, what doesn't work. And, they're very responsive because they know I'm teaching them everything that has worked after all these years of practice. And it makes their life easier. Also, remember, the biggest problem in our nation today is failure of medicine based on a very important factor, and that is non-compliance. What does that mean? Doctor makes the right decision, prescribes the right treatment, but patient doesn't take it. And therefore, the outcome is not good. Why did the patient not take it? Because the patient did not become convinced that this treatment is the best thing for me to do. This pill for me to take is the best thing. I'll give you an example. You come to our office and we find out you got high blood pressure. We keep taking your pressure over a period of time, and it stays high. You have no choice but to accept the diagnosis of high blood pressure. And you would say, "Doctor, what does it matter? I don't have any feelings. I don't have any symptoms. So why should I take this pill?" It's up to us as doctors to convince that patient that, look, you are asymptomatic, but you have a disease that's going to come back and haunt you. You don't take medicine for high blood pressure. Down the road, sometimes in 5-10 years, you'll pay a price with a heart attack, stroke, kidney failure, and multiple organ damage. By that time, it's too late. You can't turn the clock back. So please listen to us, become convinced, and take this medicine now for the future of your well-being.
Beautiful. Beautifully said.
Convincing. This takes sitting down with the patient. This takes confidence of the patient. And how does the patient believe in you or have confidence in you? Is with contact. You meet your doctor again, and you find that he or she comes through for you every time. You begin to trust him and trust his or her judgment, and you become partners. We tell our doctors, our patients, when they come for the first time, we have a system of meet and greet. And we get to know each other. And we tell them, look, you as a patient are like a captain of a ship. You also own the ship, by the way. But every captain needs a navigator. So please allow us to be your navigator. We'll come aboard your ship and guide you so that you sail happily and you don't have crashes and you don't have problems. You listen to us because we know the human body a little bit better, and we will work with you. We will explain you why you need to do something, not just blindly, but we'll try and convince you, and you become our partner. You do well, we do well. You fail, we have both failed.
So my question is, at your center, I know you have I've been there, I know you have refreshments, but do you have a TV playing this? Because I'm getting very motivated to capture you on a TV, bringing a camera, and then having a TV running in each one of your centers that your patients can sit there and hear something like this. We ought to work on that because it's a shame for it to go. It's not that it's wasted, it's on the radio and you're going to get it on YouTube, but I don't have your face doing it. I don't know. We ought to really think about something that could be very exciting.
True. My offices have captured some of my lectures.
Oh, have they?
I give lectures everywhere. I give lectures at churches, synagogues, community centers. And I've given my lectures of 10 pearls of longevity and things like that.
And so you tell them about all this, right?
Yes. So they've captured that, and some of the offices, the TVs are running and telling them what I have said before.
It's fabulous.
So it's useful information. You're right. You see, this is because of my practice of such a long time. We have found out what works, what doesn't work, and basically wellness in America is a low-hanging fruit. We are all enamored with the high technology that we have, great success in the frontiers of medicine, but the wellness of our nation is a low-hanging, simple and stupid exercise in taking care of yourself, like high blood pressure, diabetes, cholesterol, sedentary lifestyle, lack of fruits and vegetables. These are simple things that anyone can do for him or herself and have a lot better outcome and a better life to live.
Wow. Those are such smart words. And so you have seen this, and I'm sure that you record this and tell people, and I'm sure you have patients in their 90s and probably 100 who are still thriving.
Yes. I have a 96-year-old patient who walks 4 miles every day.
No.
And some of my patients come in my office in wheelchairs, sometimes on walkers, and I tell them, let's work together. I want you to get you out of this and walking on your own soon. And you have to push them, you see. And most companies, insurance companies, give even free membership to the gyms, like Silver Sneakers, where they can go and exercise daily if they want. They can do yoga. A lot of people, you see, if you don't use it, you lose it. Muscles, if they are not used, they atrophy. They just wither away. So the strength is less. So every time you try and walk, there is pain and there is disability. So if you want to get back to walking, it might be an exercise in a little bit of pain. But if you work at it, you'll be surprised. Within a week, within 2 to 4 weeks, you're so much better. And within 6 weeks, you're better to your best potential you can have. Literally, that's how fast you can become a walker again. And I tell my patients, you go to a grocery store, park your car far, walk there. Inside when you are there, so there's no rain or mosquitoes or heat, you're inside an air-conditioned environment, walk a few times more. Go to the mall, leave your credit card at home and just walk in the mall. See, you go to somebody's house who is on the 4th floor, use the stairs. Don't use an elevator. Simple things add up to your ambulatory ability, and you stop the sedentary lifestyle, which is our biggest killer.
So you've motivated me even a lot more because I live on the 7th floor in a condominium, and sometimes I'll walk down, but I don't often walk up, and I guess I should start that, shouldn't I?
I tell you why. Walking up will give you a bigger boost to your quadriceps muscles. These are the muscles in the front of your thigh. These are your get-up-and-go muscles. When we lose these muscles, we end up in a wheelchair or nursing home. If your quadriceps muscles are strong, you can get up, you can go and poo, you can be ambulatory, and you are independent. You lose your quadriceps muscle, you become a cripple. And none of us wants to end up in a nursing home or a wheelchair if we can help it. And this is the best way to avoid that.
So talk about that 96-year-old gentleman. Was he always like that, or you encouraged him? Was he always healthy?
Well, he was walking less, but I congratulated him. So he became so motivated that he increased from a couple of miles to 4 miles. He said, I enjoy it. that way I don't live very far from a shopping center, so I go there and I pass my day. I meet people. I've made friends. In fact, he's got a couple of people who join him. So,
my.
It's become a social activity. We are social animals, and a lot of our seniors are cooped up in their own apartments.
Yep.
I would like them to get out.
Right.
Because we are social animals. We need that social interaction with other human beings. So I tell all my patients, if you live in a condominium, please make sure you know your neighbors.
Yeah.
If you don't see your neighbor for a day or two, knock the door and say, Sally, I haven't seen you. Are you okay? You bake something nice, go and share with your neighbor. Now, that connection, that talking, that exchanging words and emotions is very powerful antidote to the aging process.
Now what I have to do, because you're so great, I have to do a little bit of commercial for you because people are saying, how do I get there? Who do I go to? Okay. We've been listening to Dr. MOSHIN JAFFER, and Dr. Jaffer founded Senior Medical Associates, which are leaders in senior healthcare, and you can see that by listening to him. Together, he says, we can achieve the healthiest version of you. So they offer immediate appointments, on-site lab and EKG, and x-rays, wound and skin care, joint injections, on-call 24/7, minor surgeries, pulmonary function testing, wellness care, multilingual physicians, meaning they speak a lot of languages, extensive specialty network, immigration physicals, and most Medicare HMOs accepted. They also have what they call a free meet and greet, and Dr. Moshe was talking about that. Now, appointment at one of our 10 full-service medical centers. Yes, 10. They're going to be very close to you. I'm going to give you their phone number. Remember, this is Pencil Talk Radio. It is 954-659-9690. 659-9690. And if you want to get on the web, it's seniormedicalassociates.net. Now, if you live in Coconut Creek or Coral Springs or Deerfield Beach or Hollywood or Pembroke Pines, Plantation, Oakland Park, Sunrise, Tamarack, Weston, or outer space, I have to tell you that Senior Medical Associates should be your primary care physicians. And they absolutely are. I mean, you can just hear it. And this is the founder, so he makes sure that, let's see, and you have 5 other physicians besides yourself?
7.
You have 7. Wow, the picture missed a few people.
Yes.
Okay. 7, because you've grown so fast, because it pays. You see, people are looking for what you profess. Absolutely. It's like people are looking for organic food. Now you have to look for the right physicians. Don't accept just what Dr. Moshe was saying. There are a lot of doctors that are 9 to 5, and they look at their computers. They don't look at you. They don't motivate you. So you can take plenty of pills, but without the kind of caring motivation that Dr. Jaffer just expressed for the last half hour, it's not going to happen. So I'm just happy to always have you on our show, Dr. Jaffer. I mean, I have to tell you, I can see why people want you to come and talk. As a matter of fact, I had a request for, I think, a doctor to make a speech over at a very big senior community. Do you go out and do that?
Yes, I do. It's my pleasure.
Okay. I'm going to give them your name because I know you will wow them. It is just... my heavens, you're really something. And you have a family, because I know I deal with your son. He's not a physician, but he works in your office, doesn't he? He runs the office.
Yes.
And
Indeed, yes.
And tell me, you have other family?
Yes, I had another son who used to help me with marketing, but we've given that marketing job to somebody else. He's doing something else. But what I feel is that what you just said, all of us, if they learn something, is to find a physician who becomes their partner. If not, then you need to find a doctor who becomes your partner. It is so important, really, because aging is a time when, as you get older, things start happening. It's an older body, so more things happen, more chances of cancers and problems and so on. And if you get somebody who changes your destiny, then you've done yourself the biggest favor. Because you could be the richest man in the world like Bill Gates, but you can't buy a new body. So this is all what we got. It's the most valuable gift we have received in life. Let's take better care of it. So that if we live long, we have a long, healthy life, not miserable in a nursing home.
Right. Just die sitting in front of your TV set at the age of 100. Right? No, but
we've got a capacity of living 120 years, really. The oldest person today is 116.
Yes, I remember there have been a lot of people. And that 100, where does that person live? Usually it's not in the United States.
Well, there was. She was in Georgia, but now the oldest person is in France. Before that, she was in, usually it's ladies. And
Right.
was in Japan. Yes, ladies live longer than men.
And why is that?
On
I know
average.
we're almost out of time, but why you think that's true?
One of the reasons is the ladies are a little better attuned to their body. They pay better attention to their body. Men, we are a little more blasé.
Oh.
And most of the time, my senior patients come in because their wife brings them in.
Right.
They
Well,
would have rather not come, you see.
yeah, I know. Well, they just
find
don't
that
know
the
you.
women yes, the women are much more attuned on an average basis. Some men are good, but mostly women listen to their body a little bit better.
Okay, well,
And
thank
that's
you.
Perhaps we feel that may be the reason for their longevity.
Okay.
And also the hormones play a part.
Yeah, I'm sure that's true. Well, Dr. Jaffer, as always, I'm just thrilled. You've motivated me. I'm sure you've motivated a lot of our listeners, and I cannot thank you enough.
It's our pleasure. Keep walking.
Yes, thank you, Dr. Jaffer. Goodbye.
God bless you all. Bye.